Auscultation of abdomen is of great importance for the diagnosis of acute intestinal obstruction, in which initial period of a disease increased peristaltic noises are heard, often coinciding with cramping pain, rumbling, gargling, sonorous noises with metallic tint, the sound of falling drop, with jerky pressure on the anterior abdominal wall during auscultation, and often without it, splash noise is determined, which occur to the shaking of the fluid accumulating in intestinal loops. The complete absence of a sound during listening, deadly silence, is a formidable symptom indicating paralytic ileus or peritonitis.